The next feature I'd like to talk about is annotations. Annotations are points that you can set on the images that can help the surgeon find a way back or to any part of the anatomy. Annotation points allow physicians to create a preoperative path. These can be nonlinear, so they can be curved, unlike the surgical plan, which is very linear. Annotations can also mark any type of location that they want to maybe avoid. Say the anterior ethmoid artery is a good example. You can also make a trail of annotation points during navigation with the assistance of somebody else in the operating room. These can be used in a teaching scenario to help residents, trainees learn how to find different parts of the anatomy that they're required to identify in training, such as the anterior ethmoid artery. They can also be used to create a curved pathway like the frontal drainage path, and we'll demonstrate that as well. During a procedure where they may be taking biopsies for some type of cancer, you can use an annotation point to mark where they took that biopsy from in case they have to extend their surgery past that point if those biopsies come back positive. Okay, to set up an annotation point, go into the annotations menu, find what you want to annotate, and what we're going to try first is the anterior ethmoid artery. And to find that, you kind of scroll from front to back, and you're going to look for this little outpouching of the orbit, and it's usually superior, and you can actually see the pathway of the arteries on both sides here and here. So you can drop an annotation point there, and you can change the color, and you can also name it. So if you want to abbreviate anterior ethmoid artery, you can do that, and you can even notate the side. And for the other one, we can mark that here, and drop another point. We can name that left. And change the color to red as well. Another useful place to use this is for the frontal drainage path. Here we would find where that path is located, either through the sagittal or the axial views. You can see this patient has a very wide frontal drainage path on this side. So we could drop a number of points, change the color, continue to drop those down in this pathway. The nice thing about these annotation points is, at least on your 3D models, they show up all the time, as well as in your virtual endoscopy view. They are only visible on the 2D views when you're in that particular plane that you set that particular point at. So for instance, we no longer see the anterior ethmoid points, but if I start to scroll into the area where those were, you will see them appear when we get to that location. And there they are.